medical coding. So he will be in such a state where he can audit or he can quality check the work of junior medical coders and senior medical coders. And after that stage, it is like a platform from where you can really go up. Once you become a quality analyst, you can become a group coordinator. That is, you will be involved in giving work to a particular number of workers in your team. After that, you will be team lead, and from team lead, you can become billing manager, coding manager, and from there, it is, according to your talent, you can reach any levels. Okay. Now, if I talk about medical coding, I can talk a lot, but I need to show you exactly what is the work of a medical coder on a day-to-day basis. So here I have a sample record. A typical health record is nothing but the history of the patient's condition. First of all, a medical health record has the demographics of the patient. What are the demographics? Patient's name, address, date of birth, and other employment details, and specifically his we have Aadhaar card here. There they have SSN number, social security number, all those details, including his insurance names and insurance IDs also will be given there. Why we need the demographics is to see whether we are coding the correct account or not. So demographics will be there. Then what is important is your second part, which is called as a history of present illness, which describes the condition for which the patient has come to the hospital for treatment. So this is what is very important. This is what you should read. This is what you will find what is the problem with the patient and how he was treated will be in this part of the health record. Health record is very important. Now we are having electronic health records. And electronic health record or health record can be also used as a medical legal document. Supposing I'm not happy with the treatment, I can go ahead and sue the doctor and I can use this as a evidence. So let us have a look at what a coder has to do on a day-to-day basis. You may be coding about 50 to 60 or 100 of these records every day. So just have a look at this so that you will know what exactly is medical coding. This is a 66-year-old white male was seen in my office on month, date, and year. Patient was recently discharged from doctor's hospital at Parkway after he was treated for pneumonia. So patient was discharged from a hospital after he was treated for pneumonia. But the problem is patient continues to have severe orthopnea. So what is severe orthopnea is these are the terminologies that we have to understand. Here orthopnea means when a patient who is having any respiratory problems, if he's sleeping flat on his back, he will not be able to breathe. So that condition is called as orthopnea. So orthopnea was there for the patient. He's still suffering with orthopnea, and then he's having paroxysmal nocturnal dyspnea. So what is paroxysmal? Sudden. Nocturnal means nighttime. Dyspnea is difficulty in breathing. So these are very complex sounding terms that you have to read, and this is nothing but terminology which will be taught to you. So he was having sudden nighttime difficulty in breathing. Then he was having cough and which was greenish in color. So greenish color or light yellow color indicates infection, bacterial infection. So these are the signs and symptoms of the patient. And his exercise tolerance is about 2 to 3 yards for shortness of breath. That means patient was not even able to walk for 2 to 3 yards and he was becoming breathless. He was having shortness of breath. And patient was actually using a medication called Coumadin. Coumadin is a blood thinner, guys. Blood thinner is given for people who have cardiac issues or they have this coronary artery disease. So this will be a drug that is given which is called as Coumadin. So the patient has stopped taking Coumadin, and recently he had a new condition which is called as atrial fibrillation. Atria means it is the uppermost chamber in your heart. We have four chambers. The top two chambers are known as atria, and this condition is atrial fibrillation. Usually, atria will contract and expand to pump blood, but here he is having a condition which is the heart is literally shivering. So that is called as atrial fibrillation. And of course, patient has long-standing history of ischemic heart disease. Now here, ischemic heart disease is nothing but the common term for this is heart attack. He had a heart attack and then he had a systolic dysfunction. That is, he is having atrial fibrillation. Then he is also having the ventricular dysfunction and he is having a cardiac defibrillator that is implanted. This is a small device which is implanted in a patient so that patient's heart condition or irregular heart rhythm is controlled. And his fasting blood sugar this morning is 130. So this is the history of what he's suffering at this point of time. So after listening to all this, the patient will be having a physical exam done by the doctor, and physical exam, whatever is the finding is noted down. Like vital signs, blood pressure is 120 by 60, respiration 18 per minute, heart rate is 75 to 80 beats per minute, irregular, and weight is 207 pounds. So all these details after physical examination is documented. Here, HENT stands for head, ears, eyes, nose, and throat. So head is normocephalic, eyes, no evidence of anemia or jaundice. Here, the doctor looks at your eyes to see if your color of your whites are nice and white. If it is very pale, it is an indication of anemia. And if it is having yellowish color, it is an indication of jaundice. That's the reason why doctors look into your eyes. Oral hygiene is good. Neck, then he's examining neck, supple, and you have the jugular vein, which is in the neck, and your carotid artery also is there. So they check it, and they also check whether your thyroid gland is properly in place. Your trachea is also in place. They will look at that. Then they will check the lungs using a stethoscope. So what he's finding here is there is an abnormal condition where there is severe inspiratory and expiratory wheezing. That means when the patient is breathing in and breathing out, there is a very hard wheezing sound. Okay, and cardiovascular is the heart sounds, is telling that there is a normal first and second sound here. Okay, and there is also a murmur to be heard in the apex. Okay, now they're looking at the abdomen. When they look at the abdomen, they usually want to see whether your liver or spleen is enlarged. Here they're saying that no such condition is found. And extremities, that is your hands and feet, they check. And here they're finding that the patient is having some swelling, which is edema. Okay. Now, the medical record will also have what is known as your medications that the patient uses on regular basis. So he's using Ambien, Ambien 10 mg, that is a sedative. You know, if the patient is suffering from insomnia, that is sleeplessness at nights, he will be having this Ambien 10 mg at bedtime. And Coumadin, of course, I told you, is a blood thinner usually given for patients with cardiac conditions. And then you have patient is using Lantus, that is insulin, 50 units every morning. And Lasix is a diuretic. A diuretic helps in prevention of swelling by eliminating water from the body. And Flovent is actually a inhaler. Okay, so these are the medications that are listed in the patient's medical record. So after reading this, a medical coder has seen that these are the diagnoses that the doctor has identified, and this is the plan. So, what is the diagnosis? Atherosclerotic coronary vascular disease with old myocardial infarction. Atherosclerosis of coronary vascular disease means your coronary arteries, which supply blood to your heart, are filled with fatty substances. So that leads to your heart attack. So he already had a mild old heart attack, is having the atherosclerosis, then he's having moderate to severe left ventricular dysfunction, is having diabetes mellitus, that is your diabetes. Then you have your other condition which is because of diabetes, that is diabetic nephropathy and renal failure. And he's also having a device which is called as implantable cardioverter defibrillator, because he's having a condition which is known as atrial fibrillation. And then he's on a chronic Coumadin therapy. And it's very important, whenever patient is on blood thinner or aspirin for blood thinning, it has to be mentioned. So after all this, the doctor has a plan. And what is the plan? He said, we'll see the patient, will continue with this present medications, and he will come and see me in my office after 4 weeks. So this is your plan and diagnosis. But these diagnosis has to be done on a medical bill. So we have to convert these into codes. The reason why we use codes is, if we are going to do, let us go to the solutions first, then we'll go to the next one. Here, the first condition was atherosclerotic coronary vascular disease. So for that, you have a ICD-10 code which is called as I25.110. So this is a small little code which can be placed in the box in an electronic bill. Now, patient also had an old heart attack, so the code is I25.2. Then patient is using Coumadin, which is very important to mention. So we are giving Z71.01, which is a code for long-term chronic use of Coumadin. I48.91 is the code for atrial fibrillation. And here there was no procedures done, except that doctor just interacted. He didn't give any x-rays or any test, or he didn't do any procedure, but he just had the services done in his office. So the code, CPT code is 99215. So this is how it is coded. So you can see alphanumeric codes are 7-digit codes which are used only for diagnosis, and for procedures it's a 5-digit code. So this is about your wait, let me go back to the session now. We are going to have the question answer session now. But before that, I want to tell you something about how these codes are built. There are certain billing softwares that we use, and these codes are entered onto that bills. So let me see if I can show you the bills as well. And after that, we can discuss about whatever doubts you have, guys. Okay. So let me just check if I can show you the bills. One minute. Billing forms. We have certain billing forms which are known as your CMS 1500, and wait, just let me see if I can find it. One minute, guys. So I'm sure you're able to see this. So whatever is coded by a medical coder will be entered as ICD-10 codes in this bill. As you can see, if we were going with the traditional way of billing, you're not billing the patient, you're billing an insurance company, and the insurance company will be having multiple number of bills on daily basis. So he will not have the time to go through the entire 20, 30 pages of a medical record. So he will be having a convenient bill which will tell him what are the diagnoses that are going to be billed as ICD-10 codes here. As you can see, these are the ICD-10 codes, and you have the next column where you have the CPT codes entered, and you will have the entire charges given here. So this is your billing form. So this is very, very convenient, and as soon as they see this bill, the insurance people will either think about approving the claim or they might reject it. So this is very, very convenient. That's why we are supposed to code everything in this alphanumeric or digital code so that it will reduce the burden of an insurance personnel to go through a claim. So this is a very crucial process, medical coding, because all the billing is done by the billing team after the medical codes are being updated by the medical coders. So whatever codes which are given by the medical coder are very, very important. We should not be over coding or we should not be under coding, because if we are over coding, the insurance loses the money, and if we are over coding, it is the doctor who is if we are under coding, it's the doctor who is going to lose the money. Okay, so let us look at this is our convocation ceremony where the first three batches were given their course completion certificate. Okay, so I want you to have any questions that you have, you can uh, ask me. Okay, so any questions, guys? I'm expecting a lot of questions because I know everybody is very much interested in knowing more in detail about what is medical coding.
Hi, ma'am. Good afternoon. Here, Mirza with you. Ma'am, about the medical terminology. For this terminology only, we get the code or on the any diseases diagnosis, please. Yeah. Actually, sir, I want to know that this medical coder, when we go to learn the classes, it's depend on the medical terminology. The course will be given or on the diagnosis basis what madam was telling, because we need actually the most important is we need to know the terminology first, the medical terminology. Yeah, then the people will go the part for diagnosis and dead end for coding. Yeah, Yeah. 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 Okay. So what is difference between this medical billing and coding? Both are the same personality or they are different? Uh, uh, okay. Okay. Yeah. Okay. Which role is more part of the thing? Medical biller is best. Uh, medical bill will go. Yes. So can the medical coder will be the next biller or this is a different part? As ma'am was giving the promotion level, no? It's maybe junior coder then. Okay. Medical- oh, okay. So this session is total 2.5 month, I think, 2.5 to 3 months. So per hour means it almost I think 90 hours, nearly 90 hours. So all those who are now will join, he will be or she will be like a medical coder only. So what is the certificate? And that is certified medical CMC or this is what professional coder? AAP. Okay. So for the examination, this is different part. Afterwards, we have to. What is this offline? Weekly, once or twice, we have to go for offline. So what will give any workshop or? Yeah. Uh-huh. Yeah. Yeah. And, uh, without this certification, also we can go for placements, no? Uh, Research results. Uh, For offline classes and online classes, people they have different fees criteria or same. Yeah. Mm, mm. Okay. So just I was asking because offline and online. So anything difference between offline and any fees criteria will be changed or while there. So whenever we need, we can come and sit in the classes also. Oh, oh, okay. But this medical coding, this coding, which software is using? Hmm. Ah, okay. Okay. Yeah, yeah. Actually, I was in Middle East for last 15 years. As a in charge for the pharmacy. So I was seeing medical codings, but we couldn't go on that subject because we were out of the platform. But now, after from last 2 years, we are in keen interest to have this one, but couldn't get the time. When the time gets, the age was almost completed. Now, yesterday I talked to ma'am also, so that's the reason why he told that today. Yes, yeah, yes, 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 yeah. So, about these admissions, we have to come directly or online also we can. Uh, 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 Mode of payment, what I mean to say, mode of payment, admission, everything. Admission. What is the admission system? You will get ID cards, everything like this. Mm, mm, okay. We the login number. Mm, okay. Yeah. Mm, okay. So this is. Can you share me the WhatsApp location of the office? Uh, okay. Okay. Thank you so much. Uh, okay. Okay. Thank you. Thank you. Okay. Yeah, yesterday she told Mr. Gotin sir he will be available for you always. Okay. Yeah, okay, okay. Thank you. Yeah. Ah, she, okay. Hopefully Monday or Tuesday I will come because ma'am told she will be in Tuesday in the Hyderabad office. Hmm. Hmm. Yeah. Yeah, yeah, Monday, Monday. Hopefully Monday or Tuesday I will come directly to the office so that we will discuss the things. Okay. Thank you for to joining me on this class and almost another session will be there. Okay. Soon I will upload there. Okay. Okay. Thank you very much. Yeah. Okay, fine. Thank you.